on your side. You're watching WRBL News 3 this morning.
Well, this is the year of 2022, but black women continue to be impacted when it comes to receiving proper health care.
Yeah, our News 3's Chris D'Agostino spoke with a local doctor about what continues to cause these disparities in health care for black women, especially for those right here in our community. Take a look.
According to the CDC in the United States, black women are 3 times more likely to die from pregnancy-related causes than white women. I spoke with one local obstetrician gynecologist about why this multi-layered issue continues, even as the medical field and research continues to advance. According to the Georgia Department of Public Health, in Georgia, black women are 2.3 times more likely to die from pregnancy-related causes than white women. Whether you're looking at the deficit from a national standpoint or a state standpoint, Valley Healthcare's obstetrician gynecologist, Dr. Kamisha Harbison, says it's not the number we should be focusing on.
The maternal death rate for African American, I don't think the number is as important as saying that it's higher than anyone else's.
So why are black women being disproportionately affected by maternal mortalities?
It's a complex problem. It's multi-layered. There are things that we need to do as healthcare professionals to make certain that we're listening, to make certain that we're mindful that we are providing everyone with the same level of care, as well as making certain patients have access to care.
Dr. Harbison says access, listening, and the ability to understand all patients and their cultural backgrounds is imperative to decreasing these numbers. According to the Association of American Medical Colleges, or AAMC, in 2018, only 5% of U.S. doctors were black, compared to the 56.2% of doctors who were white. Dr. Harbison says a good way to begin changing the issues black women deal with when receiving health care is by increasing the number of doctors who come from the same background.
And we need more. We need more people that look like the people that are in need, who share a common cultural background. Not that other ethnicities providers cannot, but certainly growing up and understanding that culture certainly provides an extra layer of protection for those patients.
She says breaking down these cultural boundaries with her patients allows them to feel comfortable sharing more. But what happens when these women live in rural areas compared to a city?
They came in to me for one thing, but I can see that they have some other things going on. But if no one is seeing you.
Dr. Harbison says access to health care is so important, not only to treating medical conditions, but to preventing things like maternal mortality caused by pregnancy complications.
And we began to address those problems prior to pregnancy. Now we can start the pregnancy at a much more even playing field with other ethnicities.
According to DPH, 87% of the maternal mortalities Georgia saw in 2018 were preventable, which brings us back to the main problem. Black women are not being heard by medical professionals at a disproportionate rate. And it's not just poor or middle-class black women who are facing this issue. Prominent U.S. athlete Serena Williams' birth complication story highlighted this very problem.
She's one of the most decorated athletes in U.S. history. You know, why was she ignored? And she was ignored. And what stands out about her is the fact that she's African American. And that's why she was ignored.
The tennis star was experiencing shortness of breath caused by blood clots, but her concerns were ignored by healthcare officials until a CT scan proved she was right. The story highlights a grim reality that a solution for this issue goes beyond structural protocols.
I can put the protocol in place, but if I don't have the nurse that's willing to listen to the African American woman saying, hey, I'm feeling this, hey, I'm passing clots, hey, I'm feeling lightheaded. I can have all the protocols, but until I can get that provider that doesn't share the same background to hear them, that's the difference that needs to be made.
Dr. Harbison says besides listening and access, it takes community-oriented healthcare facilities like Valley Healthcare. They can provide transportation, government-funded healthcare, and pharmacies and more. It's also education, getting out into the community and teaching young Black women about their bodies, what's normal and what to look out for. Back to you.
And here at News 3, we are always taking pride in focusing on the community-based stories. And during this Black History Month, we continue to tell the hidden history of the Chattahoochee Valley.
Yeah, that's right. Tomorrow on News 3, in a special series, we invite you to join us all day long for stories honoring Black history. And here at News 3, we're always